Good evening. Thank you all for being here. My name is Sakina, and I have the distinct honor of serving as co-founder and national president of Future Doctors in Politics. And on behalf of the entire FDIP team, it's my pleasure to welcome you all tonight. We could not be more thrilled to be sharing this virtual space with you as we kick off our Future Doctors in Politics Bedside to Fireside Chat series with surgeon, advocate, and nothing short of physician superhero, Dr. Joseph Sakran. We'll get to introductions in just a moment and hear about Dr. Sakran's incredible bio. But before we do, I want to take a moment to share the inspiration behind the Bedside to Fireside Chat series. Fireside Chats, as you all likely know, were radio addresses delivered by Franklin Delano Roosevelt during the height of the Great Depression. But they weren't your run-of-the-mill stilted presidential speeches. They were a historic attempt by an American president in a moment of profound crisis to connect directly with the American people. When the future looked bleak, when the American dream looked dead, when the country's survival looked questionable, FDR and his administration doubled down on the idea of a government of the people, for the people, and by the people. FDR harnessed what was then cutting edge technology, the radio, to make clear that his government didn't just work for its citizens, but with them. He opened many of his chats with my friends and used the time to be honest about the magnitude of the challenges facing the country, to explain his policy ideas for the country in words people could understand, and to inspire people to believe that if they could put fear aside and put faith in not just themselves as individuals, but in the collective, that together they could build a better tomorrow. That's what FDR did at the fireside, and he did it for millions of Americans at a time. But it's also what the best doctors do at the bedside every day, one patient at a time. Doctors meet their patients where they are, earn their trust at a moment of profound pain and anxiety, break down what is happening to them in words they can understand, and map a path forward to make things better for themselves and for their families. And in this moment of profound crisis in this country, with a broken health system, with the future of democracy itself in question, we think it's time that doctors started doing this beyond the bedside and started doing this in city halls, in state capitals, in legislatures, and in Congress. Doctors are not just trained communicators, but we're also people who see the human cost of policy and political dysfunction every day. We simply can't afford to stay on the sidelines as our elected leaders fail and our patients continue to hurt and our communities continue to suffer. At FDIP, we believe in the power and promise of doctors making politics and policy in this country what it's supposed to be, how we, the people in a democracy, solve problems and save lives. It's that idea that gave birth to FDIP, and what began as a big idea is quickly growing into a movement. We now have 7 chapters in med schools coast to coast in the FDIP family, with 10 more in the pipeline. Our chapters are grassroots, and they're powering our work nationwide to motivate, educate, and train medical students to drive patient-centric, equity-oriented structural and political change. We recently hired an amazing national organizing director as our first full-time staff member, and she's supporting our chapter development and championing our grassroots mobilization efforts across the country. All of this combined with national programs like the one we're bringing you tonight is how we hope to equip our generation of physicians with the skills we need to be advocates that make our politics work for patients and communities. Our Bedside to Fireside Chat series is where we get to have candid conversations with people who are already doing this, with physician leaders who are taking what they see and do at the bedside to make a difference in our politics and policymaking. And Dr. Sakran is a true trailblazer when it comes to this, when it comes to forging this intersection between caring for patients and addressing the root underlying causes behind what makes them sick and what endangers their health. We couldn't be more fortunate to have this chance to hear his powerful story and learn from his blueprint for change. We do envision this as a conversation, so all of you, please feel free to use the chat function to submit your questions. We'll ask as many of them as we can over the rest of the hour. So without further ado, let me yield the floor to one of our stellar national team directors, Alex Soltani, and my co-moderator for tonight to introduce Dr. Sakran and get us started. Alex.
Hello, everyone. My name is Alex Soltani. I'm a second-year medical student at Wake Forest School of Medicine and co-director of the Health Policy Collaborative here at Future Doctors in Politics. The Health Policy Collaborative is a group that coordinates educational programming around health policy, advocacy, equity, and health systems for fellow medical students. We're really excited to host you all for our event. This is our lane, Physicians Driving Political Change to Save Lives. As Anam mentioned, if you have questions throughout the discussion, please feel free to use the chat function at the bottom right of your screen and send them to all panelists, and we'll do our best to get all of your questions answered. Today, I have the pleasure of introducing Dr. Joseph Sakran, our speaker for this evening. Dr. Sakran is a trauma surgeon, coalition builder, policy advisor, public health expert, and nationally recognized advocate for gun violence prevention. In addition to being an active clinician, Dr. Sakran is widely known for building diverse coalitions and advocacy efforts within public health and policy communities. In 2018, he launched This Is Our Lane, a community of medical professionals dedicated to reducing firearm injuries and deaths. Dr. Sakran has been publicly recognized for his public health expertise, specifically on firearm injury prevention. He has been honored by the Agency for Healthcare Research and Quality and Academy Health, as well as selected by the National Academy of Medicine to be a Robert Wood Johnson Foundation Health Policy Fellow, where he worked on congressional health policy and regulatory issues from 2019 to 2020 for Senator Maggie Hassan of New Hampshire. Dr. Sakran received his medical degree from the Medical School for International Health in Israel, a collaboration between the Ben Gurion and Columbia universities, and he completed his general surgery training at Inova Fairfax Hospital in Northern Virginia, and later completed a fellowship in traumatology, surgical critical care, and emergency general surgery at the Hospital of the University of Pennsylvania. Dr. Sakran, thanks again for being here.
Wow, thanks so much, Alex. And it is honestly a true honor to be here with all of you. I've had the opportunity to get to know Anam over the past couple months and to really learn about the incredible organization. And I've heard you now say it, FDIP, so I think that's going to stick. What a tremendous group of individuals. And I just have to say that I've been so impressed by people that are in medical school. And we know how hard it is just to simply get through the basic studies, let alone start an organization, start a national movement that has really, I think, inspired not just medical students, but healthcare professionals across the country. So I just want to say to the leadership that I'm so proud of you all. I think this is tremendous. And I think once again, we are seeing the younger generation, even though I still consider myself young, that are really kind of showing us the way. So let me just start by saying that. So it's really a true honor. And I honestly just look forward to a very open and candid conversation. And I'll just, start by saying, I never imagined in many ways to be doing the stuff that I'm doing now. And life has honestly a very interesting way of, going down this windy path that you may never expect. And each and every one of you, regardless of whether you happen to have joined tonight because you're interested in gun violence prevention or you're passionate about a different topic, I think that each and every one of you hopefully can harness that passion and figure out how to impact lives beyond the bedside. And so maybe I'll stop there and turn it over to our incredible moderators to kick us off.
Yeah, absolutely. Thank you so much for that introduction, and we're excited to have you. Truly, it's truly an honor. To start, if you could just kind of walk us through your journey a little bit. How did you decide to dedicate your life to gun violence prevention and become a trauma surgeon?
Yeah, so like I've kind of was alluding to, I never planned, I think, going down that path. I grew up the son of immigrants. My mother was born in Lebanon, but grew up in Haifa, and my dad was born in Nazareth, and they came to the States, over 40 years ago with really pretty much nothing. And I think, like most parents, I would say maybe especially immigrant parents that, have very little and are searching, for a better life, not just for themselves, but for their kids. They really focused on education. And I just remember, dad leaving. He was an aerodynamic space engineer. He'd leave like at 5 a.m. in the morning. He'd make that we were living just outside of DC in Northern Virginia, and he'd make this trek across, into DC, where the Patent and Trademark Office was at the time. He was a patent trademark examiner. And he would come home late at night. And my mom, who was a teacher, she would go to work all day, only to come home late at night to ensure that not only, we were fed, but that we got our schoolwork done. And so education was a real, I think, critical piece of our upbringing, both for my siblings and I. And I think what honestly none of us, Alex, really expected was how our lives, not just my life, but our lives as a family would change at the age of 17, when I was nearly killed after being shot in the throat with a 38 caliber bullet. And I know that a lot of you listening tonight are probably closer to that age of 17 than I am right now. And I suspect you all are much brighter and more innovative. So maybe you had big plans at 17, but I think, like I tell many people, I was kind of living day in and day out, not realizing the fact that I was mortal, not really, having any, I think, global like perspective about what I wanted to do in life. And when that happened, it really kind of just upended not just my life, but the lives of my siblings, my parents. And it really allowed me to grow up pretty quickly. And I think, I don't know, Anam, if I shared this with you, but I think really the moment when all of this kind of changed was I had come out of the hospital. I had a tracheostomy tube. My injuries, I know there's a lot of medical students. I had a carotid injury. I have a paralyzed vocal cord, which you can probably hear a little bit of my raspy voice. And I had a ruptured trach. And when I came out of the hospital with a tracheostomy tube, and I had these, of course, beet red scars up and down my neck from my exploration that they did. And I remember this is when everything kind of was like, it was like an aha moment. I was standing in the mirror, and this is a couple months after my injury, and I was just devastated. It's my senior year of high school. I should be hanging out with my friends, going to school, having the best time of my life. And here I am with a trach and all these other issues. And what I didn't notice was my father was standing in the corner. And I think he saw that look of devastation in my eyes, and he walked in and he said, "Look," he said, "Joe," he said, "what happened to you was terrible, but you can do two things. Number one is, and I think this was, tough love from an immigrant dad. He said, you can feel sorry for yourself, right? Or number two is you can take this horrible incident and turn it around to try to impact the lives of other people." And I think that's when everything changed, where I was like, well, he's right. I've been given this second chance. And that's, Alex, back to your question, how I got here. It's what inspired me to go into medicine. It's what inspired me to become a trauma surgeon. And it's what pushes me to work at this nexus of medicine, public health, and public policy to really try to get at the root causes of what we're seeing in communities all across America. And the last thing I'll just say, because I've been talking for too long, is that, sometimes you don't see it at the time, but the worst moment of my life also turned out to be the most impactful, because I probably wouldn't be here doing the things that I'm doing had it not been for that incident.
That's powerful. Thank you for sharing that. I want to ask a little bit about the nexus that you just mentioned between policy, public health, and medicine. How did you discover that nexus? Where in your journey did you find that, actually being at the intersection of these three is where I can make the most impact? And maybe share a little bit too how you think being a clinician, being a physician, a surgeon who sees the human cost, as we say, of these problems on a daily basis, how does that then inform your unique lens when it comes to public health and public policy?
Yeah, okay. I'm going to take those as two separate questions. So the second one you may have to remind me, but okay, here we go. So it wasn't right away. That's what was fascinating. When I initially got into medicine, my whole goal was, okay, if I can give someone else the same second chance that I was given, right? Then okay, that's it. I've done it. I've made it, right? That was purely my goal. That was my focus, is to be like an incredible clinician, to save the lives of other people that had suffered similar injuries the way I had. And a couple things happened. The first is, it wasn't until, I would say, probably my fellowship at the University of Pennsylvania, where I started to realize that I wasn't just another trauma surgeon. I was actually someone with a story. And hopefully we'll get into the story piece tonight, because I think each and every one of us that are on here tonight, we all have a story, right? And sometimes we don't realize the impact and the power of our own story. And so I think about when it first happened for me, that I realized, wait, I actually have a narrative here that people want to hear. Because I always would think, like, okay, who wants to hear from this guy that's been shot in the throat? Like, what's so special about that? That's the way I thought about myself. Like, okay, but I was a fellow at Penn, and we had this program where we would bring in essentially high school students from all around the community. And we would give them a tour of the trauma center. And then after the tour of the trauma center, I would talk to them about gun violence. And I actually have a picture of the first time that this happened. They're 14, 15-year-old kids. And as most like teenagers, they're kind of paying attention, but not really. And we're sitting in this room around this rectangular table. And I hadn't told them my story yet. And I was like, trying to figure out ways to like connect and be cool with these kids, I was like, I was failing dramatically, it was unbelievable. And then I told them my story. And it was just really, I would say, surprising at what happened, because all of a sudden, right, these kids started paying attention. All of their eyeballs focused on me. And it was a reaction that I had never seen before, and one, frankly, that I wasn't expecting. And what I realized in that moment was that I went from being this guy wearing a white coat to someone that could relate to what these kids are facing day in and day out in their own communities. And at that moment, what I did was I asked them, how many of you have either personally or within your extended family been impacted by gun violence? And nearly every one of them raised their hands. And so it was really just a very powerful moment that made me appreciate the power of narrative. And I think that that's something, as clinicians, as scientists, as researchers, and hopefully we'll talk about this, like, of course, the data and science is important, but that's not the whole story. Um, I think in regards to, the second part of your question regarding like what I do and how that impacts how I view things. Um, Look, like, and I always tell people that I love my job. It's just such a special job. I mean, just imagine for a second. I know a lot of you are going through this right now, perhaps in your clinicals, or maybe you're in training or different stages. But imagine just for a second that a patient is going to trust you with their life. I mean, I just can't think of anything that is more powerful than that. They're going to trust you to take them to the operating room. Whether you're a surgeon that does elective surgery, or whether, you're someone like myself that does both elective and emergency surgery, right? And actually operate on them. So to me, like, it's just so powerful. Um, but the worst part of my job is having to talk to so many families, having to talk to, moms and dads, and to explain to them that their child that left that morning is never coming home again. And I will tell you that that part of my job never gets easier. And I often, think about my own family and what they must have thought about and what they must have experienced. And I have this, recent kind of very, I think, what I think to me is just, says it all about why I'm pushing beyond simply what we're doing, at the bedside or in the operating room, where I was taking care of this 17-year-old kid. And this 17-year-old kid had a devastating traumatic brain injury, shot in the head. And I had to go up to the ICU to talk to this kid's mom. And I went up to the ICU, and like I said, this is the worst part of my job. And I'm like looking in there, and I see the mom, right? We have these like glass doors, and I see her at her son's bedside. And I know that like what I'm about to do is going to rock her world. And like she's holding on to his hand. It's like, holding on to like every like last, glimmer of hope. And so, frankly, like sometimes I find myself, looking at scans again, or trying to do something that maybe, subconsciously I'm like delaying the inevitable, right? And I walk in there and I begin to explain to this mom that, her son has this devastating injury, and we're never going to be able to bring him back to the person that she knew. And as I've told, this story a couple times, I always hang on to it, because what happened next was honestly just something that I can never get over. The mom began telling me about her son, how he was, the first in their family to graduate from high school, which, in Baltimore, especially in the Black community, that's a big deal. He had these hopes and dreams of going to college, none of which will ever come true. And as she was doing this, she looked up and she saw us, the house staff, right, and the team, and like how like impacted we were by, of course, this devastating and deadly injury. And she walked over and she did something that I'll never forget. She put her hand on my shoulder and she said, "Are you okay?" Now, I just want you to think about that just for 1 second. Here's a mom that just lost her son, and she's asking us if we're okay. It's, honestly moments like that which restore my faith in humanity. And it's moments like that which get me to wake up every day to try to do everything possible to, reduce these senseless injuries. So the reason that I push beyond are not just for moms like her, but because the best medical treatment for this kid is prevention.
Wow. thank you. Thank you for sharing that story and for just inspiring us all to, I don't know, be mindful and aware of the impacts that we are able to make and we're going to make as future clinicians. I think it's something that we, on the day-to-day, we kind of just sit in the classroom and kind of, it's easy to kind of be numb to what we're actually doing and why we went into this in the first place. And just to hear these stories it's really a true honor. I mentioned that before, but it's extremely an honor and inspiring to be sitting here listening to the impact that we're able to make and the impact that you've been able to make.
I usually don't tell that story till the end because it's usually hard for me to, continue on after that story. But it was natural in the conversation. And again, it's not meant to, depress people, but this is the reality of what we're facing in our communities. If you haven't seen it, you're going to see it if you're in healthcare.
Truly, and I think it really encapsulates how high the stakes are in this work, and how the day-to-day of a clinician should create a sense of urgency around these issues that unfortunately most times seems very lacking among our policymakers and our elected leaders. And you had an interesting entry point into this when This Is Our Lane emerged. Would love to hear a little bit about, from your perspective, and I'm sure many of us in this room are familiar with some of the backstory behind This Is Our Lane, but it felt like this moment where what the physician's role was being called into question, and it became, I think, a launch point for us to have this conversation around what is a physician's responsibilities to broader society, to go beyond the bedside, to make an impact on these issues at their root, to really prevent these issues from escalating to the point where you're having that conversation with that mother.
Yeah. So, just for a background for some that may not be familiar. So in 2018, essentially the NRA came out and said that doctors have no business in being part of the solution around gun violence prevention. And they said we should stay in our lane. And let me just say this, this movement is not just me by any stretch of the imagination. It is, and it's not just doctors. It's docs, it's nurses, it's researchers, it's respiratory therapists, it's people within healthcare that are touched by these patients in so many different ways. And I think when we saw that, I think a lot of us, frankly, were incensed because, here we are, the individuals that are at the center, right, of taking care of these patients day in and day out. And, I've said this before and I truly believe it. And that's, if any one person or one organization thinks that they can solve this problem on their own, either they don't really want to solve the problem or they don't really understand the complexity of it. Because, this is a public health crisis. It's a complex problem that there is no one solution. It requires a multifaceted approach to really, break down all of these different barriers depending upon, the type of injury method you're talking about. And here's what I mean. When you look at suicides, for example, we know, that impacts a lot of older white men, for example. And we know suicides, right, also comprise 2/3 of gun violence deaths. When you look at homicides, right, now we're talking about, the impact on urban violence in communities of color, right? Young, brown and black men that are being slaughtered on our streets in cities like Baltimore and Philadelphia and Chicago. And then when you're talking about unintentional injuries, right, you may be talking about the kid that picks up the unlocked firearm in the home and shoots their friend. So all of those problems, right, are not going to be fixed by one solution. And so, back to your question, so a lot of us were just really, at our wits' end. And here's the thing is, I just want to be very clear about this, because the problem are not responsible gun owners, okay? The problem when you look at an organization like the NRA is that you have leadership that doesn't represent the membership, the majority of those responsible gun owners. And we've seen that time and time again, and we can talk about that, right? But when you think about why we as a healthcare community in this movement were so successful in getting that message out there, it wasn't because we came out and we said, hey, 40,000 plus people die a year of gun violence. That was not it. Why were we so successful, or why were we able to at least get that message out there? It's because we understood that the data and science alone does not change the hearts and minds of Americans. It's the stories, it's the visuals. And when you think about, translating whatever that value is that you hold near and dear to your heart, when you think about translating that value into action, that's done through emotion. And I don't mean being an emotional basket case. I mean being able to tell that story. And if you can do that effectively, right, then you're going to be able to impact a lot of people. And as some of you may have seen this, there's a great Simon Sinek talk. I think it's called The Golden Circle, right? Have we talked about this in M before? No? Or yes, we have? Okay. So like for others, so it's like the why, the how, and the what that he talks about. And the whole point is that, like, when you look at successful companies, the reason they're successful is because they focus on the why. They focus on getting you to believe in what they believe in. And that's the purpose. And I think for each of us here, right, we have something that drives us. We have a purpose. We're passionate about something. We have to harness that. The last thing I'll just say, related to kind of this and like stories, I know a lot of you are in medical school. I always ask my medical students what their story is. And this is often the answer I get. I'm a third-year medical student on the surgery rotation. So they're giving me their CV. Now, if I have the opportunity to spend, some time with them over the rotation, their answer is very different at the end. So I want, all of us, and it's not just medical students, by the way, faculty, are not good at doing this. I mean, there's a lot of people that are not good at understanding, the power of story. But think about what drives you and why you're here, and how do you encapsulate that, in 30 seconds, in a minute, to really demonstrate to someone else, who you are and why you're doing what the stuff that you do. Did that kind of get to your question, and
Yes, absolutely. Absolutely.
Dr. Sakran, I want to ask a little more about kind of giving a domestic framework to the work that we're doing here in the United States. And, in watching some of your interviews, you kind of describe gun violence as a uniquely American issue. And I just was wondering if you could elaborate on that and share sort of what you mean and some of the policies that are that we perpetuate in this country that perpetuate this issue.
Yeah, I mean, so look, a couple things. When you look at, overall what we're facing in America, and you can look at these charts, I mean, they're just very clear that we are disproportionately high compared to all other comparable countries. And there's been numerous types of studies and ways to look at this, where you look at the murders in the US and you look at the proportion of those murders that were through the means of firearms. And when you compare that to places like Australia, New Zealand, Germany, Austria, right? We are off the chart by 29 times plus, okay? And so other nations, comparable nations, are not facing the type of devastating injury that we're facing. So that's number one. That's why this is a uniquely American problem. In fact, going back to Anam's last question about this is our lane, one of the most interesting messages that we got were from people, healthcare professionals who practiced outside the US. And you know what they said? They said, hey, Joe, actually, we don't know what it's like to take care of these patients day in and day out, because they don't see those type of injuries constantly. So that's why it's uniquely American. Now, I think this is people, when you think about this and the complexity of this disease, I think people often don't understand, well, why is this a disease? Why is this a public health problem? So when you think about public health, right? Public health is, right, it's the ability to take science, right, and to use that to reduce and prevent injury, disease, death, and to promote the health and well-being of populations. And when you think about this and why we call this a public health problem, well, it's because this complex disease is happening in communities all across America, right? And I'll tell you this, Alex, some of us have been working on this issue for quite a long time. And it wasn't until I think recently that it's gotten a lot more attention. And I think part of the reason it's gotten a lot more attention are because of the mass shootings that get significant media attention. Now, we have to be careful when we talk about this, because the mass shootings comprise less than 2% of this overall public health problem. And, this may not be a popular statement, but it wasn't until, suburban white schools started getting shot up that people started paying attention. But like I said before, listen, every day there's young men, primarily from communities of color, that are being injured and killed on our streets. And, we have a responsibility to tell those stories. And that's what we've tried to do, because when you look at the disparities that exist are tremendous. So, we've tried to really, again, pound day in and day out and say, listen, you got to look at this as something more global than simply, this random, mass shooting that happens here and there, which of course now is not as random as we think. Did that get to your full question, Alex?
Yeah, thank you so much.
It's such a tragedy when you think about where we are relative to the rest of the world. And there's often this notion of American exceptionalism. And here we are exceptionally wrong and exceptionally challenged in addressing this issue that has plagued us for so long. And so what in your mind, if it's a uniquely American problem, what is the uniquely American blueprint for change? What is the strategy for how we break through the status quo? Because we know that there is widespread public support for several pieces of reform, and yet those pieces of reform have not seen the light of day. So what in your mind is the theory of change that is finally going to get us to see some progress on this front?
Yeah, I think that's a great question. And let me just take that in a couple parts. So first of all, when you think about the theory, of change, as you put it, yeah, Anam is always, way more articulate than I am. And she has a way of kind of coming up with these terms. I think of this compared to other diseases, okay? So think about what happened in the 60s and 70s with car fatalities, right? When this was happening, this was a total public health problem. And the solution wasn't to get rid of cars. We, came up with seatbelts and airbags, and we figured out how to make the road safer. That theory and that approach, right, that public health approach went from focusing on simply changing human behavior, which we know in and of itself is not cost effective, right, to actually developing a system that makes it less likely for people to be injured. And like we talked about a little while ago, that there is no one solution, right? And I think I sense in your question a little bit of skepticism, right? About like, well, hey, nothing has been happening at the federal level. So like, what are we going to do about this? And I want to I think this is a really just important like point that we dissect out a little bit. So first of all, we haven't seen the type of change we want to see at a federal level, right? I mean, it wasn't until, just the last cycle where finally, after like 20 plus years, Congress appropriated dollars for research, which by the way, was a drop in the bucket, but still monumental in and of itself. But we haven't seen anything else done, even though, as you say, there is a significant amount of support from the American people, from the public. And that, by the way, that support includes both gun owners and non-gun owners alike. So now, here's what I'll say is, what you have to recognize is that most governing in America happens at the local and state level. And in fact, when you look at like, I think in 2018, there were like 68 pieces of common sense gun legislation that was passed in states all across this country. So I want to just be very clear that yes, of course, we live in a country that of course the borders are porous, right? You can buy a firearm in Virginia and then drive over to Maryland quite easily, or any other state for that matter, right? So there is that porosity that exists, which is why we need federal kind of legislation. But let's not underestimate what is happening in our own backyard, in our own state capitals, right? With community organizers just like yourself that are saying like, no, like we're not going to wait for them to fix it. We're going to start right here. And that's been powerful. I mean, I'm sure a lot of you have seen, the Incredible Moms or the March for Our Lives, young kids. I mean, like there are just so many people that are taking this matter into their own hands. And when you look at our, kind of federal, overall perspective, things have changed there as well. And let me just give you kind of a quick example. In 2008, okay, there were around 63 Democratic members of Congress that had an A rating with the NRA. In 2018, that number I think was 3, and now it may be 0. The point is there's a paradigm shift that's happening in this country. So things are changing, not at the pace that we wanted to. And oh, by the way, let's not forget that we just had a presidential campaign where we had candidates that were running, okay, with gun violence prevention as a central part of their platform. So it's not changing fast enough. I don't think we should wait for it. We should engage in our own communities and our own backyards. But I think we are seeing progress. I hope that kind of helps answer your question.
No, absolutely. And I think this is a critical point that we try to make to the students in our movement, that, oftentimes federal legislation gets the most attention, but state and local politics is a powerful venue for change that does often have a more direct effect on citizens across the country than anything that might be happening in Congress. In your response, I think what's transparent is the role of the political process, whether it's federal, local, or state, in being able to address this problem and so many of the problems that plague the health of citizens across the country. I wanted to get your take on physician engagement in the political process. And of course, you have done this on your own as someone who's testified before Congress, as someone who has been involved in political campaigns as well. But there has been a notion among physicians in the past, and perhaps it still lingers today, that we should stay above the fray. We don't want to get involved in the messiness and in the drama and the theater that politics unfortunately often is. And we're professionals, and this isn't our lane. We've heard that unfortunately from physicians as well. And so where do you see the current state of play in terms of physician engagement in politics, and what do you think is the role of clinicians politically when it comes to confronting the root causes behind the problems they see at the bedside and in the exam room every day?
Yeah, I mean, it's such a great question, because I think a lot of us that have spoken up over the years have received significant, I won't just say, backlash and repercussions for trying to elevate our voice and elevate the issues, but have been silenced in many ways, especially early on. Now it's much harder to do. I mean, people can still do that, but a lot of it is done much more discreetly now, because people are afraid, I think, in many ways. But here's what I would say direct to your question. Think about, right, us as clinicians, right? And as clinicians, we have to know all this different information, whether it's physiology, right, or path, right? We have to know all this information and bring it together to care for the patient, right? To be able to provide patients with the best possible high quality care. But guess what's been missing? It's the social factors, right, that we have completely negated. We've been so focused as a healthcare system, like what happens within the four walls of the hospital. And granted, we've had a lot of improvements over the last 100 years, where we've improved quality, delivery, technology, all this stuff. But what happens after patients leave the hospital? How does a patient's social status, the ability to have food security, the ability to have a job, the ability to live in a safe neighborhood, how does all that play into healthcare? And for so many, I think, years, a lot of us in healthcare were looked at like, well, that's not your kind of avenue, you shouldn't be dealing with it. But it is directly related to the care of our patients and to how our patients do. And I think when you look at this traditionally, in traditional medicine, I'm calling it traditional medicine, right? People say, well, you really shouldn't be doing this. You should just be focused on taking care of the patients. But the reality is that we are part of, this fabric of society. And when you look at how the public, right, views us as healthcare professionals, I would say in general, we are trusted public messengers. And I think we have both the opportunity and the responsibility, right, to be a part of those solutions and a part of that change. And it's, by the way, not just for gun violence, right? We've seen the past couple of years how healthcare professionals have spoken up around COVID. We've seen this around immigration. We've seen this around racism. We've seen this around health inequity. We've seen this around climate change, right? People are like, well, why is climate a healthcare problem? Now people are starting to realize, well, actually it is. I'm not saying we all have to be involved in this, right? But I'm just saying that there is an intersection between health and these social movements. And who better than people that understand health, that are trusted public messengers, to be part of that change? And I want to be very careful and clear about something. I'm not saying that everyone has to, you know, do this as part of their career. But what I'm saying is that there needs to be a proportion of us that are interested in thinking beyond the bedside. And as someone who's a very active clinician, I totally respect, you know, clinicians that that's what they want their focus to be. But we have to meet the policymakers halfway and understand and be part of the changes that they're implementing. Because frankly, a lot of times there's policy that's being implemented without people understanding what's happening at the front line. And so I would say that we are part of that change, and being part of that change also requires us to understand what that process is like. And that's one of the reasons I went to the Senate, to better understand the legislative process at the federal level. And if I know we're almost out of time, but if I can just quickly share, I learned three big things. One is that our voice as frontline clinicians are so important to people that are just doing policy every day, because they don't see what we see. The second is that it's not just about us having good ideas, but we have to understand the right strategy and approach, because these issues are complex. And the third, and you may be surprised to hear me say this, especially in divisive times that we live in, but bipartisan legislation is not just, you know, a better look for America. I think it actually leads to better legislation. And I know it's hard to see with what we're seeing on the media, but I can tell you when I went into the Senate, the staffers in general that are coming in day out, both Republican and Democrat, are there because they really want to make this country a better place. And I think that there's a lot of commonality that exists among us as Americans. And it's not necessarily always the end result that's different, but it's how we sometimes get there. Let me stop there. I'm sorry. I know I continued to ramble on a little bit.
No, that was extremely well said. And I think, you know, it's something that's so critical. You know, we're, as you know, as you a physician, as physicians in training, you know, we're so focused on treating the patients that we have in front of us, and we have a duty to our patients. You know, we this Hippocratic oath. But you know, I think we forget that the healths of our patient populations are being changed. You know, all the time, 90% of the time that they're not, you know, they're not in front of us. You know, and I think it's so important to understand that. You know, if we can make an impact at the bedside, that's so wonderful. And you know, if we can make an impact while they're not in front of us, that's even more impactful. And so I think that, you know, like you said, not necessarily decreeing that every physician should do that, but having physicians recognize that this is a really important lane that they should be present in if possible.
Yeah, I agree, Alex.
And so we're going to try to fit in two more questions, if that's okay.
Okay, yeah, please. Yeah.
One audience question we have, kind of going back to the impacts that states and local counties and local levels can make with regard to gun violence, really significant impact. We have an audience question here that asks, when considering local politics and those environments, especially in areas with significant prevalence of gun violence, like Chicago, Baltimore, how do we reach the audience that we need to effectively? Is that education, you know, local legislation?
Yeah, I love that question. So here's a couple things. First is, and I don't know if this is what the person implied that was asking, and I'm sorry, I can't see who asked it. But here's what I would say is one of the mistakes that often happens is that, you know, a lot of us, you know, sitting in our, you know, ivory towers think that we know what's best for communities. Communities know the solutions that they need. And I've always, you know, pushed and advocated that we need to elevate the people that are closest to the struggle. We need to find those community leaders and empower them and partner with them, real partnerships, to actually bring the solutions to their communities. In fact, today I was talking to this amazing, amazing man. He goes by Uncle T in Baltimore. And I mean, he has just a tremendous story. He's a Black man that, kind of, grew up with, very little, had a very rough upbringing, was in the penitentiary for some time. Then his son was killed at the age of 18 after being shot. And he took all of that tragedy, that adversity, and turned it into something so positive, where he is impacting the youth in Baltimore. So, I was talking to him about, understanding what does a landscape look like. I think engaging community leaders like Uncle T, right, to figure out how we can break down the silos in these cities. Because right now, Alex, the health department doesn't talk to law enforcement, which doesn't talk to the healthcare system, right? And then you have this like cycle of individuals that are going through all these different sectors, where we should be communicating and interconnecting, so we can understand the right type of support and to provide these folks. So engaging those closest to the struggle is so critical. And if we have time, I'm happy to talk about specific stuff, but I know we're almost out. I'm sorry.
We're almost out of time. The hour has just flown by, and truly, Dr. Sakran, we could talk to you for hours on end, because your insights are just so rich and that deep. But as we close out, actually, this is a perfect segue to what you just mentioned. We would love to hear from you what actions we as physicians in training can do now to confront the issue of gun violence, but also broadly, as you mentioned, the social determinants of health and all of the various issues that are plaguing each of those domains, and that unfortunately disproportionately burden certain communities more than others. And so what concretely should we be thinking about and doing at this stage in our training?
So I think there's two broad things. So one is, what we're trying to push for is within medical education to empower healthcare professionals, starting early, to be able to have the knowledge and skills to talk to their patients about gun violence prevention measures, like, for example, safe storage. Similar to how you would ask your patient about smoking, right? And as you may or may not know, depending upon how you were raised, meaning were you raised with, a firearm in the household or not, what sociogeographic region do you live in, you may or may not be comfortable talking about this. So we have to raise that comfort level up and empower, people like yourselves to be trained to ask those questions. The second, more broader one, when you think about, like, what can we all do? Like, if you think about, like, what is it that we can do? I think about this thing that Sarah Brady, right, the wife of famous press secretary for Ronald Reagan, that was shot. That, of course, a lot of you know the Brady United Group was named after. And in full disclosure, I'm a board member there. But she said that if the lawmakers won't change the laws, then we must change the lawmakers. And so what is the one other thing that all of us can do? That's vote. And I'll just tell you that most people don't vote. The voter turnout rate is so low, depending upon the poll you're looking at, it could be anywhere from 30, 40%. I think different demographics can have a little bit of different numbers. But the reason it's so low is because most people don't believe that they can make a difference. And, I'm here to tell each and every one of you that not only can you make a difference, but I think we have the responsibility to make a difference for the next generation. And, just to be able to say that at the end of the day, we made this world a better place. So that would be kind of, my response.
It's a beautiful way to close. Thank you so much, Dr. Sakran.
Thank you all so much. It was just such an honor to be with all of you. And I'm so excited about FDIP, and I really look forward to engaging with you all in the future.
Thank you again. And you're such a busy Man, and it's just such an honor for us to have you take so much time out of your day to speak with us and share your story, impart your wisdom, and share with us kind of what we can do ourselves too, and tangibly move away from this talk with actionable items. So thank you again, and that concludes our
That's my
programming.
pleasure.
That concludes our programming this evening. I want to make a note. Please mark your calendars for our next event, Pathways to Universal Coverage, on December 6th from 8 to 9 p.m., where we'll be joined by Dr. Sherry Gleed, Dean of the New York University Wagner School of Public Service, and Drs. Abdul Sayed and Micah Johnson, authors of the book A Citizen's Guide to Medicare for All, for discussions on the various policy options to expand public health insurance coverage. We look forward to seeing you there. And if tonight has inspired you and you want to get involved in building this movement for change with us, follow us at Future Doctors in Pol and reach out to info@futuredoctorsinpolitics.org. Thanks again for being here and have a great night.